Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
All right, good morning, good afternoon, good evening, everyone. This is a special webinar from the USMLE Sarthi team, and today you will hear from a lot of decision makers, and you can see Dr. Akhondi already on. He is the program director of internal medicine residency program in Nevada, Centennial Hill. With him, we will have other speakers as well, some of our students who have done rotations, then we'll have other attendings as well. So the agenda for today is how do you plan your rotations, your research? What do program directors actually look for when they see USCE in your profile? How can you actually do well in your US clinical experience? And, what are the things that you should be doing as part of your USCE and maybe even research? So before we get started, in terms of housekeeping, you can ask questions in the chat. Me and my team are there. We will be answering questions in the chat. We do have a very full agenda here. So like I said, we have a lot of senior speakers, program directors. So we will get started and, then I will take you through rest of the agenda. So getting started, it is my pleasure to introduce, as I said, Dr. Akhondi, who is the program director, internal medicine residency program in Nevada. So welcome, Dr. Akhondi. Very glad to have you here. And I think all the students are very, very keen to understand a program director perspective. What do you look for when you see IRA CV come to you? What are you looking for?
Okay, thank you so much for having me today. Well, the first thing I look forward is usually, of course, the scores, right? Because I know scores does not reflect everything, but it is a standardized test. Everybody has taken the USMLEs. So it's one way to, to compare people to each other. It's certainly not the only thing. I look into the applicants, their research, their personality, a bunch of things come into effect. For our program specifically, we require a permanent resident situation. So, that is also something I look into. But, there are programs that accept J1 and H1 visas. So that's obviously a different story. When the scores are good, in the acceptable range, and our screening is around 230 for step 2, then, other factors kick in. The main thing is if somebody has really good communication skills, meaning that, they are fluent in English. I know, I have an accent. A lot of our applicants have an accent. That's never a problem. As long as you are clear, you are understandable, and you speak loud and, in a manner that is appropriate and not disrespectful. So if you have good communication skills, you think fast, you can communicate fast, that plays a big role in it. And of course, there is research. I'm a fan of research, so the more research, the better. If these are retrospective or prospective studies that have been published with a PMID, obviously carries a whole lot more weight. Other things are important. Personal statement is something that will not elevate your application, but it can definitely hurt your application for sure. Avoid writing something generic that everybody writes. As soon as I see someone writing about the grandmother who had this ailment and now they are shaken to the core because they want to cure that grandmother, I mean, that's nice, that's very humanistic, no doubt, but it's nothing original, and sometimes it's fake, so it makes you wonder, okay, what are you talking about here? Be original, be yourself, write something that's, appropriate and creative, novel for sure. That will be helpful. So US environment is obviously different from rest of the world. I have practiced, in Middle East, in Europe, in Africa, US, different setting, different expectation, different everything. Life is a little bit different here, like in Europe, you want to go anywhere, it's train and walk. Here it's fly and take a car, as an example of how different US is. So expect something different. It will be extremely helpful, and you should have some experience in this system, at least a few months. So, US experience is an absolute must. It's not even, necessarily like the medical knowledge you gain. It's more like know the people, know the system, know how it works. Make sure your communication is good, understand what's expected of you and what's not expected of you. That is probably more important. Don't do something that will put you in trouble.
So, Dr. Akhondi, just to summarize, because you hit on some very important points. In terms of an IMG, obviously, you said scores are important, visa status, whatever it is, different programs have different criteria. Visa status is something. Communication, you said communication is very important. Then you said research. So research publications can really help IMGs in their residency match. Then you said personal statement, how you articulate what you articulate, don't make it generic. But I think the other thing which you said, very important, US clinical experience. So when it comes to US clinical experience, how many months or what is the duration you look for, and what are the specifics you look for? What should a student have done in the USCE?
I mean, I would say at least 3 months, if not more. The more the better. It can be anywhere with anyone, really, as long as they are in a real clinical setting. I
Okay.
realize it's hard to get hands-on experience because, there are regulations about the insurance and, malpractice insurance. Although you think that I'm just going there and observing, I shouldn't have an insurance. But a lot of hospitals, almost all of them now require even observer students to have insurance. So, because of that, it might be a little hard to get hands-on medical experience. However, it doesn't have to be hands-on. You can go there, watch stuff, and learn and communicate. And, the more you do, the better. If you do it with different people, even better, because, you have seen different people at work.
Yeah. And when it comes to say how you want to understand what they have learned, so what are the typical things you want to know? Do you want to know actual how do they interact with the patients, or how do you find out what they have written in the IRA CV they've actually done? So give us examples of some of the questions you ask,
Yeah, that is a really good point because, as you mentioned, in the era CVs, you see stuff, and then when you talk to people, you realize that that never happened, or it's a gross exaggeration of what happened, probably. So
Wow.
yes, I do check, and I want to make sure that everybody is truthful. And my recommendation is that please be truthful. There is no shame in saying something that's suboptimal or not perfect, but at least you are honest. If you lie, then that will put you in a lot of trouble. I will give you an example. Sometimes when I interview people, I ask about their hobbies and they say, "Oh, I play chess." And one time I asked somebody, because I do play a lot of chess, and I asked him, "What's your favorite opening in chess?" And he was not able to give me one opening, which is, showing that basically he has no idea what chess is. He's just making it up because it's something intellectual, right? As opposed to saying I play football. But hey, just say I play football. Nothing is wrong with that. You don't have to be playing chess. So be truthful and honest. and that is the best way to go ahead with it. I ask questions about what rotations they have done, what they learned in that rotation, and it shows. Absolutely.
Okay. And as I'm taking some questions, I know you have to leave, but I'll take some questions for you. Meanwhile, Swati, if Dr. Akhondi also helps our students in rotations and research. So if you can put the link for students who may be interested in his rotations, Arti or Swati, if you can put that, that'll be great. Meanwhile, I'll take some questions for you. So does year of graduation matter when you are looking at these applications? Do you have a cutoff?
It does, and different institutions have different numbers. Some people take immediate graduates. Some people with high demand, they just take from the senior graduates. Some people do 2 years, some places do 5 years. Uh, I think our institution was 3 years last year. So if you are out of residency more than 3 years, it's not impossible though. You just have to do more work because the feeling is that maybe you have forgotten what you learned back then. So yeah, the sooner you get into the system, the better.
Okay.
Otherwise, you have to do more work.
Yeah. So what you're saying, I think, is there is a cutoff for year of graduation, but it's a soft filter. It can be overcome by doing more experiences. Okay. The other thing, if someone is working as a medical assistant, so I'm reading these questions. If someone is working as a medical assistant, does it constitute USCE, or do you actually want what is USCE?
Yeah, that should be a good thing. Yeah, medical assistance is great because you are in the system, you are doing the work, you are interacting with patient. No, that is considered experience. Absolutely. USC can be a lot of things: medical assistance, observing things, hands-on rotation. Just doing research with someone might be considered that because that is also important. So as long as you are in the system, you are learning the language, the communication skills, the legality of the medical system in the US, you should be good.
Yeah. Uh, does doing a master's or a PhD help?
We have a spreadsheet when we are interviewing people and we give grades to people. Year of graduation gets, this amount of points, scores get a lot of points. Letter of recommendation, by the way, that I didn't mention, gets some points. Yeah, and I will get back to that. And yes, when you have a PhD, you get extra points because, that's something academic, and certainly MPH, MBA, all of those, MHA, all those are good additional certificates to have. Having a law degree certainly will help.
Oh, law degree helps?
So law degree, yeah, we had 2 applicants with a law degree last year. Actually, one of them is our current resident, yeah, a lawyer and a physician.
I see. So you were talking about, and maybe this is the last question before I let you go, about the importance of letters of recommendations. Can you
Yes.
talk a bit about the LORs?
Right. So for LORs, obviously go to somebody who is prominent in their field. Program directors, associate directors, faculty that are very involved. And go to people that that they like you and they are likely to write better recommendation letters for you. Be careful about going to someone that might write something that's suboptimal because there is a code in these letters, and basically it has been written in Morse and you have to decipher it. And I have been in courses talking about the letter of recommendation. So it might look okay, but when we see it, it's not okay. We see it as okay, don't take this person. And some people actually write it down clearly that, okay, this was a bad rotation and I don't like this guy and I don't know why he asked me to write a recommendation
Oh my
letter.
God.
I have seen that too. So, yeah, be careful who you are asking. and then make sure that they know you really well. They have been working with you directly for at least a few months, and hopefully they are in a prominent position. And it does help if somebody who is the chairman of medicine in, I don't know, in a Ivy League school writes you something good, you are in good shape. Absolutely.
Yeah. Well, thank you, Dr. Akhondi. This was
Sure.
very, very helpful. I appreciate your time this
Of
early
course.
uh, on a long weekend. So thank you very much. I think this was very useful to the students. And yes, if anyone is looking to rotate with Dr. Akhondi or otherwise, so Swati and Aarti have posted the links. So take a look at those links and let us know if you have any questions. So thank you, Dr. Akhondi. Appreciate your time.
Thank you so much.
Thank you. Let's move on. I do see Dr. Weissman there. So, Dr. Simcha Weissman, are you there? Yes.
Hi, how are you, Pawan? Good, good.
So, just by way of introductions, Dr. Weissman is the Director of Clinical Research at Hackensack Palisades, has been helping our students for the last, I think, 5 years in rotations, in research, very prolific in research. And that's why I was holding back on some questions. But as Dr. Weissman has come in, so Dr. Weissman, continuing on the theme, the theme is US clinical experience, what people like you who are in the selection committee, program directors, or otherwise, what do you look for in an applicant when you see the ERAS CV, when you read the maybe the letters of recommendation, and broadly, first importance of USCE, then maybe we'll talk about research.
Yeah. So, first of all, great to see everyone here. I'm Dr. Weissman. I'm from New Jersey. I've worked with many Sarthi students over the last, half a decade, both clinically and in research. And I'm colleagues with a lot of different associate program directors and chairman of departments locally and even more regionally. And just to kind of answer the first part of the question, uh, echoing on what was said a little bit previously, very important is the quality of the letter, right? So somebody who you've worked with that's going to be able to vouch for you in a sophisticated level with high quality ideas. This student was someone who showed interest in patient care. Give an example of this student was someone who we rotated on a patient who had rhabdomyolysis and they knew how to appropriately bolus them with IV fluids. Very concrete, specific details about how that student was interested in internal medicine or whatever, specialty you're going into, and showed very good character traits that would be a residency program would be interested in seeing. And we'll get into that in a little bit, but essentially more is the content of the letter. And then after that, yes, is that person a chairman? Is that person a community doctor, or are they somebody affiliated with a institution? So, a lot of students are very caught on with, the letterhead. Is it a this letterhead? Is it that letterhead? I would argue that some programs want to even see that you've rotated in the outpatient setting, for example, just to kind of give a good balance to things. But more important, much more important, is the content of the letter. Are they saying very specific things of high quality traits, or is it more like a vague statement saying this student did a rotation with me, period? That's would be my main thought.
Okay. And I will, kind of read the questions because they reflect the most recent concerns. And one of the concerns nowadays is, as you know, visa issues, right? So there are all this uncertainty. So obvious question is, are tele-rotations considered USC? I know you help a lot of our students with tele-rotation. So talk about tele-rotations and how students can leverage tele-rotations, and do program directors consider tele-rotations?
Yeah, so that's a good question. I think we started this after the COVID era, and it really continued to this day, and especially more recently when there's issues with visas and traveling restrictions from certain countries, and in general, students who, it's hard to relocate, it's hard to pick up a flight and expenses along with traveling, etc. So we have a wonderful tele-rotation. It's all virtual, but before I talk about our specific one, I think that most important thing is you're showing different programs your interest in medicine, right? You're showing them your interest in learning. You're showing them your involvement with clinical skills, with patient care, and I think that would be the way you'd leverage it. And the letters of recommendation would sort of say this, student worked with me. We saw a couple of very interesting cases. It wouldn't say exactly what the context or the nature was, but it would talk very highly about you and show them that you're someone who's serious about medicine, interested in internal medicine, and you want to do anything to learn in an academic setting. So I think that's a very important trait. And I've personally noticed that a lot of these students who did the tele-rotations and letters went very far, matching as residents. So I would venture to say that it is very, very positive viewed. Yeah.
Okay. Now, when it comes to the actual, say, rotations, and this was the question I asked Dr. Akhondi also, what do you expect them to have learned from those rotations, and what type of questions you ask that reflect the learning? I mean, how do you assess the learning in the tele-rotation or on-site rotations?
Yeah. So, when it comes to pretty much any type of rotation, one of the biggest things that doctors look at, whoever you're working with, is going to be professionalism, number one, and interest, right? A doctor wants to see you're punctual. You show interest in learning. You're very curious about medicine. You have interest in patient care. So that's the most important part. Obviously, your medical knowledge will be weighed to some degree. But I would say most important, if you come very humble, eager to learn, very willing to learn, you read up on different things that the doctor tells you about, that's going to be something very positive for you.
Okay. Let's switch gears. And by the way, like I mentioned, Dr. Weissman has helped a lot of our students along with Dr. Atut in rotations. So Aarti and Swati, if you can put a link to their on-site as well as tele-rotations, I think a lot of students have benefited in the previous years. And we do have two of your students just going after you, Nardos and Mikail, who did tele-rotations with you. So after you will get their perspective also. So Aarti and Swati, if you can put that link for students who are interested. Now let me switch gears a bit, Dr. Weissman. Questions on attempts, so step one attempt or CK attempt. How do programs look at that?
Yeah, so unfortunately, that's going to be one of the things that they're very serious about. There's not that much forgiving about step attempt. You really on your first try, you want to pass step one. You really want to pass. Step two, you want to really crack that 230. If you can't get a 230, at least a 225. At least a 225. Really want to hit a 230. There are ways to amend a little bit. Obviously, not to jump right into research, but we'll talk about that in a bit. Publications would help you. Great letters will help you. But less forgiving is first attempt, and then a 230 is really what you want to get.
Okay. Let's talk about, I'm sorry, day in the life of a on-site rotation student with you. So let's say a student comes for on-site rotation with you and Dr. Atut. Walk our students through day in the life. What can they expect? How will the 4 weeks go?
Yeah, so essentially what we have the students do is we have 3 days a week of didactics in the morning. So we have a lecture either by myself or Dr. Atut on different topics of internal medicine, core topics, sepsis, pancreatitis, heart failure, great core topics, 3 days a week in the morning. And then usually the way it works is you do 2 days a week of clinic. You're in the clinic. You come in maybe 8:30 in the morning. You get a username and a password. You get to kind of look at the MR a little bit. You will check on some patients with him. You talk about the interesting cases. He might even let you administer a vaccination or B12 injection in front of him. And essentially, you're really there learning in a very academic setting. He'll be, pimping you he has some residents in the office also, so he'll be really working hand on hand with the residents. The other days you'll be with me. I round. I have a whole bunch of patients, mostly patients who get admitted for acute things like pneumonia, CHF, pancreatitis, colitis, very cute. And we try to keep it very academic. Try not to, try just to have the students there to learn. With us, you're just there to learn. We're not trying to get you to do vitals or anything for us. You're there to learn. We try to keep it very academic. We try to teach you things that we want to see that the residents try to learn. And we try to keep it very academic. And then a little bit of nursing home rounds as well. So, we try to give a mixture of things to kind of make it real life what a resident will be doing.
Okay. And now switch it the other way if someone cannot travel and if they are doing tele-rotations. So day in the life of a tele-rotation student with you.
Yeah. So essentially, telerotation is also 3 days a week. It's on Zoom, at the comfort of your own home. It's usually in the mornings. And we go through different cases of hospital admissions and walk through, how you would admit the patient, how you triage the patient. We talk about assessment plan and then higher level teachings, as well as questions that the exams like to ask on these patients. And we sort of walk through that during every one of the lectures. At the end, you can get a letter from myself. You can get a letter from Dr. Toots. You actually get two letters. Get two letters from that. It's a really good experience, a way to kind of boost your CV, get some letters, and without having to travel, relocate, etc.
Okay. One more question. And I'm reading, if I have my own clinical case, can I present it during the tele-rotation and get your feedback?
So we don't allow students to present their cases then, because we want to be doing the talking and the teaching. However, you could just share it with us, maybe a case you had quickly at the end, or ask a question on it, and we're happy to chime in. And some of the sessions are with the residents also, so you kind of get to hear what they say and they could chime in, but we would try to kind of maybe lead the teaching to us, and we could let you, if you're with us in person, yes, then when we have like a lunch break, I would let you kind of get on the screen, present it for the other students or residents there. Yes.
Okay. All right. Now let's switch gears to research. All right. A lot of questions about, is research really useful? What does it mean when I say I've done research? Do community programs look for research? Is it some special, only one specialty? So talk a bit about importance of research and, publications.
Sure. So it's a good thing. And research has always been a part and parcel and a core component of residency programs. The ACGME requires residency programs to do research, the residents and their faculty to do research. So because the ACGME requires the residency programs to do research, the programs want to make sure that their applicants do research. It's very simple. It always was a big thing. Now, because step one is pass fail and there's less weight on maybe step one, more of the weight shifts to other things. And one of those other things are research. A lot of programs I know, and I spoke to different program directors, they filter based on research. It might filter, smaller community programs might filter based on one paper or two papers. Larger programs will filter maybe 3 or more projects. When I say projects, you don't have to necessarily get it into the best journal, but something that goes on your ERAL CV as a research project. And I'll talk about that for a minute. So, essentially, when ERAS opens up, you get to put in the name of your paper or your abstract, where you presented it or where you published it, or the status. So if you submitted it, you put submitted. If it's accepted, you put accepted. If it's published, you put published. But at least something goes on your ERAS CV. And I would say at least, I can't, it's really a red flag if you come to your residency interview and you don't have one thing, or maybe only one thing as your research. They'll say, what happened? That would be the first thing they say. Why don't you have research? That's kind of how it's looked at now. There's no way around it. So the importance is certainly there, and we try to help with that. We've been very successful about that. And I don't know if you have further questions on research. I can go on.
Yeah. No, I do. So meanwhile, for those of you who don't know, Dr. Weissman also helps our students in research. So, very, very prolific. So Swati, if you can post that link as well for Dr. Weissman's research courses. So please do that. For those of you who are interested in enrollment, Swati or Aarti can explain to you the timeline. But yes, Dr. Weissman, I did have questions. So first, let's talk about your research course. Again, day in the life, 8 weeks research course. Students, what can students expect to do?
Yeah, so the research, the way we've really ramped up this course, it's such an all-inclusive course now. It's actually closer to like a 5-week course now, or 6 weeks, really 5 weeks. What we do is we have 2 to 3 lectures a week. It's on Zoom. It's you can, in comfort of your own home, no travel. And I do one lecture a week, and I really work on mostly the paper that we're going to be working on. I pick a topic that my team in the hospital is working on, my residents, and we work from beginning to end. We break up in tasks. We pick a topic. We usually use a large database like the Sears database, and we very masterfully work from intro. I usually get the results for them. Then we work on discussion, and we go back to methodology, and we write up the whole paper. And at the end of the month, end of the 5 weeks, we submit the paper. Or if it's a poster that we work on, we have the poster ready for submission to a national conference. During that course, we also have a lecture a week on statistics. We have a wonderful statistician who lectures on statistics, and as well as somebody lectures on methodology. So we have it's a robust course. Not only you learn research, you learn statistics, but we actually contribute as a co-author every month on a paper. And I would say with 95 to maybe 97% acceptance rate. Almost every one of our projects have been accepted, except for maybe 2 or 3. But those are still pending in journals. We've had very good journals, impact factors of 4, 5, 6, and 7 even. Q1, Q2 journals. We've presented at many different conferences, different oncology, internal medicine, GI conferences. So it's a very effective way of kind of building your academia and getting your CV ready for ERAS.
Yeah. Well, thank you. Thank you very much, Dr. Weissman, again on a Sunday. I appreciate. But as you sign off, any tips for students who may be applying this season on rotations research? Any last minute tips as we are getting ready for the last 4 months to go? Any last minute tips, Dr. Weissman?
So for me, I think now is a very, very good time. I wouldn't wait. Some students like to wait till, okay, let me wait till, the end of August and then see where I am and see what I need. But that time it's late. There's things that are closed out. You might not get into a session. You might not be able to come in person anymore. Research might be full. So I think now it's the end of May. So June is wide open. July is wide open. August is open right now. I would try to jump onto something, either a research or a clinical attachment or a mixture of the two. And sort of get your, self foot in the door, get your ERAS CV all buffed up. So when it rolls around and ERAS opens up, you're ready to start filling things in. You're ready to get your letters in.
Yeah.
And
thank you. Yeah, sorry.
I think some people say about journal. Yeah, we only publish in PubMed index journals. All our journals are PubMed indexed, and the conferences are all recognized internationally. So.
Yeah, that's what I was reading the question, and so thank you for answering that again. Thank you, Dr. Weissman, and for those of you interested in rotating with Dr. Weissman and or researching, let Swati know. She has put the links, and we'll be in touch with you. So thank you, Dr. Weissman, for your very, very insightful tips.
My pleasure. Great to see you. I hope to work with you guys in some capacity, and best of luck with everything, regardless. Take care. Yeah.
All right, let's move on, and we'll move on. Actually, I had other things on agenda, but thanks you to all my speakers who joined early, so you could get a lot of insights. I will answer questions, and I do see Dr. Akhondi is still answering questions. So thank you, Dr. Akhondi. So again, for those of you interested in rotating with Dr. Akhondi, who's the program director in Nevada in internal medicine, or Dr. Weissman, let Swati know. She's anyway posting the links. If you're interested in doing research with either of them, let us know. We can help you as well. Now I do have other student speakers, especially on tele-rotations, because a lot of you had questions on tele-rotations and the visa issues and all of that. So first, let me just take a break here and see if you can put in the chat window, how many of you are applying this year in September? How many are applying for match in September? So if you can just put in the chat box, it'll help us frame the discussion. So just want to see. All right, so I see quite a bit of students applying this September, which is a good thing. With 4 months to go, hopefully you're getting all right with USCE and rotations. So thank you for that. Now, how many of you have visa issues, whether you're applying this year or next year, whether you're not getting dates or so visa issues. How many of you have visa issues? So no visa. Okay, so green card is good. So some of you have green card, so that definitely helps. If you have visa issues, obviously, I think the way to do is either book a rotation if you're still looking for visa appointment and get a visa invite letter, or I discussed with Dr. Weissman and even Dr. Akhondi, Tele-rotations could be the way to go for all of you. Research can be remote if you've done step 1 CK, if you are already ECFMG certified or will be certified. I think we can help you, as Swati is posting a link. We do work with visa experts both in India and US. They are all legal attorneys. So if you need help, we can help as well. But very quickly, for those of you who are applying this season, I did want to show you the dates. Now that many of you may already know, the dates are out for this season. So let me share my screen and show it to you very quickly. And by the way, we will have a webinar next week as well. So Swati, share the link for next week. We are going to talk about timelines and how you can plan. But this is the latest timeline that came out. It is there on the website's official website. June 24, IRAS token becomes available. You can pretty much start your application. September 3 of this year, you begin submitting your application. But the residency program, and Dr. Akhondi is, I think, still there, they will only access it on September 24th. So a lot of students will ask a question, what is the difference between September 3, September 24? The programs can only access September 24. So a lot of you who need rotations can even do rotations in September. We'll make sure that the LORs are uploaded and processed before September 24. That's an important point to keep in mind. You have till September 24, 23rd. A lot of you would be doing research, so you can submit for publication even till September 23rd. So we'll help you with that. Of course, after that, interview season starts, and that's where, a lot of you who need help, we can, both in our gold, platinum plans, bronze plans, interview preparation plans that Swati can post a link. Then, the rank order list opens, or the deadline is March 4 of next year. So just by way of planning, you can plan. March 4 is when you will submit, or till that day, you can submit your rank order list. March 17 is the D-Day when you will find out whether you matched or where you matched or not. Where you matched is on Friday of that week. But March 17 is a big day when you find out if you matched. So this was just very quickly for those of you going into the match this season. Again, for those of you who have visa issues or looking for research or match plan, Swati can help. So question, can we enroll in remote research? The answer is yes, you can enroll in remote research also. When will the pathways for 2026 application be available? Sometimes in June. Pathway application is always available in June generally. One more question before I get to my speakers. USCE after September, does it count or no? So I think, as Dr. Akhondi said, in the interview, they will ask you, what are you doing currently? Are you clinically doing something? So while the LORs may not count, but we always recommend that you be clinically active, maybe doing rotations, maybe even working in your home country. does the quality of journal matter? So I think there is obviously a hierarchy, right? So impact factor of a journal always matters. So I think some research is always better than no research, but if you're talking about the quality, yes, the journal matters, and both Dr. Akhondi, Dr. Weissman, they tend to publish in a very high quality PubMed index journal. Can in-person rotation be done on B1, B2 visa? The answer is correct. I mean, all of our students who come here come on B1. This is the business category, and they do it. We will have a session with our US attorney also. Although for those of you who were in India, we did conferences in India, and we had the Indian visa consultant who spoke on at length about the visa issues as well. All right, I don't want to have our speaker wait now. So it's my pleasure to welcome Nardos Jimmer. Nardos was a Sarthi, or is a Sarthi student, did a Tele-rotation with Dr. Weissman. And, I wanted Nardos to share experiences, the learnings from the Tele-rotation, and how this can help. So Nardos, can you share your videos? Let me see. If you have issues, maybe I can. Okay. All right. Welcome. And why don't you introduce yourself and then talk a bit about your experiences? As Nardos is setting up, I will take some questions. If I participate in your research program, will my name be published articles? Yes, of course. You're the. It will be obviously whether you do it with Dr. Akhondi or Dr. Weissman, any research program. Yes, as long as you are participating, your name will be there. Nardos, can you try?
Can you hear me?
Oh, absolutely. Now we can. Yes.
Okay.
Thank you. I think it was just the headset. So all yours, Nardos, introduce yourself and talk a bit about your experiences.
Okay, I am international medical graduate from Ethiopia. Currently, I'm residing in Toronto. And I did tele-rotation last year with Dr. Weissman and Dr. Atot. It was quite an experience for me because we have been looking into patient history, physical examination findings, and investigations. And it really helped me to really feel the clinical experience. And it really reflected on my step 2 exam too. So most of the patient charts we were looking for were really reflected on my USMLE step 2 experience. And one thing Dr. Weissman didn't mention was we also did mortality and morbidity rounds with him. So we were looking into charts of the patients, their vital sign, and what was wrong on the management side. So we were doing a lot of digging on the management. So it was for me it was a very good experience. It really boosted my confidence on how approaching the patient and how to manage the patient. And aside from reading preparation, it will really help with the clinical experience too.
Okay. And I think there is a question. So how many hours per week were you involved in the Tele-rotation?
Yeah, so it was a 1 month clinical experience, and we were doing it 3 times in a week, every morning. So it was either with Dr. Atot or with Dr. Weissman. So sometimes we see questions from UWorld. So it will really refresh our memory because we are doing questions from the materials we are like preparing from. So it's really a good experience.
Yeah. So Are you going to be applying for match this year, or when are you planning to apply?
Yes, I'm planning to apply for coming matching cycle.
All right. And overall, you will put this tele-rotation experience in your CV.
Of course, yes.
Okay. Well, thank you very much.
Thank
Let me see if there are questions for you. So any questions for Nardos on tele-rotation experience? So tele-rotation is in a group setting, right? So how many students were there in a group with you?
So probably we were around like 15 to 20 students were there from a different background. So a question will be posted, and Dr. Atot or Dr. Weissman will pick randomly someone from the students, and that student will be will answer the questions that are like posted.
Okay. And there, the question is, do you get an LOR for tele-rotation also? So you get 2 LORs, right?
So since I'm going to apply for next coming cycle, I would hopefully get 2 LOR. I don't know how much they will put the details of my participation, but I will get the LOR. And most of the time, Dr. Atos or Weissman will recognize the students because they give a lot of time for a student to participate in the conversation. So they will put their perspective on the student, on the LOR.
Yes. So because there were questions, so yes. So
Yeah.
you do get LORs from Telerotation. Dr. Weissman and Atul both will give you an LOR, so you'll get 2 LORs from that Telerotations. And okay. How many hours per week? We already answered, I think 3 to 4 hours per week. How to join Telerotation? So Swati, you can post a link for Dr. Weissman's Telerotation and Dr. Akhondi's Telerotation also. Okay, I had one Telerotation with Sarthi, but my visa has been rejected twice. Should I do more? So if you are going to be applying, I would recommend, because your visa has been rejected, we had a lot of students each year who match only with Telerotations. Of course, other parts of the application have to be done right, the research, your scores and all that. But yeah, absolutely, you can do more Telerotations. So thank you, Aarti, for posting the link. Also post Dr. Akhondi's Telerotation. I think that will also be useful to a lot of students. So, well, Nardos, thank you very much. I think your perspective is really, really helpful.
Thank you very much.
So, and by the way, students, Dr. Akhondi is answering your questions, and he is saying he has spots open for Telerotations and research. So, for those of you interested, Aarti, if you can post for everyone the link for Dr. Akhondi's rotations, thank you, and also his research. Thank you for that. Okay, now let's go to the next student, Mikail, who also did Tele-rotation. So, Mikail, welcome. And why don't you introduce yourselves, and then we'll have some interaction.
Okay, can you hear me?
Yes, we can hear you. Thank you.
Hello, everyone. My name is Mikail Pinyan. I'm IMG and MD physician from Armenia. Now I'm working at our university, the Yerevan Medical State University, as a visiting assistant professor. I apply this much, but unfortunately I didn't much. I'm planning to apply for upcoming session also. And I did Tele-rotation last summer also with Dr. Atut and Dr. Weissman.
So tell us about your experience in that Tele-rotation.
Okay, that was very useful and very interesting. We discuss patients, their lab results, their diagnosis, their outcomes, and they think that all results, all diagnosis is from real patients. It's very helpful to remember and to understand deeply. And that thing is very, I think that thing is very important and very useful.
Okay. And what about other learning? So was this telerotation useful from, say, learning perspective? Because I think Nardos mentioned about questions from UWorld and other parts. So how did it contribute to your learning?
It's very useful for learning because it's, as I mentioned above, it's real patients. And from point of view of a student, it's very important. And when you can participate, other important thing that you can participate from your home country. And without leaving your home country, without leaving your job, if you working, and it's very useful, and you can get much knowledges and also somehow US clinical experience from that.
No, you're right. I mean, for those of us who cannot travel or have financial issues or, may not have visa. So I think that'll be very, very helpful to all of them. Yeah. Well, thank you. Thank you, Mikail, for your perspectives, and thank you, Nardos, as well. If there are any other questions for them, let them know in the chat box. But I will also starting to take questions. So thank you, both of you. Appreciate your time. I know you are in different time zones.
Thank you.
So I appreciate it very much. Okay, now let me take other questions. So before I do that, yes, in terms of the telerotation, I think again there are these questions. Does it lead to LOR? So the answer is yes. Then, of course, how do PDs know if you did a telerotation? So sometimes, of course, if you have not traveled, if you have no visa, it's obvious that you did telerotation. But like Dr. Weissman and Dr. Akhondi also mentioned, experience is still experience. If you cannot travel, what are your issues, right? So alternatives may be very limited when it comes to you wanting to apply and not applying. Okay. What about timelines with CAS application? So yes, Ida, we will get to that next week. What I mentioned today was the timeline for just the application, the standard ERAS application. And yes, Dr. Akhondi and Dr. Weissman both provide online rotations as well as in-person rotations. So just to reiterate, Dr. Akhondi is an internal medicine program director out of Nevada, Centennial Hills. If you are interested, Swati maybe post or Aarti post a link for Dr. Akhondi's on-site research, on-site rotations, tele-rotations, and research, as well as Dr. Weissman's. Saifullah is asking, do we provide free rotations? There are always, some or the other plan that comes out. Generally, during the off season, we do provide it. But in the next 4 months, it's a peak season. If you are looking for free rotations, probably in October, November, we have to work with the faculty to provide that. Okay. So that's where the rotations question is. Due to ongoing visas issue, will programs prefer candidates who are already in the US? have you seen this trend in the last match season? So I can tell you, Sarthi is 10 years old. So we did see in 2017, 2018, when the similar issue came up with visas from certain countries not getting through. So it is true that applicants within the US tend to be at an advantage, of course, and B, if you're outside, work on tele-rotations. Like I said, tele-rotations are obviously remote. Research is obviously remote. And try your best if you're outside US, because a lot of students each year have matched again with only tele-rotations. I mean, we have students in pediatrics, internal medicine, family medicine. Surgery tends to be hard with only tele, right? But everything else is easier. If we already have US clinical rotations, do you help with LOR writing? We can only help if you have done rotations through us, or if you are part of our gold plan, platinum plan, or bronze plan. So we can definitely help you with LORs. I mean, we have an extensive class on all aspects of match, including on LOR. So Swati, maybe you can post that link where there are trailers for all the classes so that they can see how our classes work. All right. So post the page where they can get a glimpse of our classes. How many hours per day does it take for applicants to participate in research and publish? So, so obviously each research is different. So research courses tend to be 4 to 5 weeks, 1 to 2 hours a week in terms of classes. And that's true for Dr. Weissman, that's true for Dr. Akhondi. If you join any research course now, by September, you can target 2 publications to be submitted. So Dr. Akhondi does it, like I mentioned, Dr. Weissman does it. You can certainly get it done. How many publications can we say makes your application stronger? So let me, stop here and actually show you some data. I think that will help you understand what we are talking about in terms of research, in terms of how it all works. So give me a moment. I'm going to share, and Aarti specifically from my team made this, so thank you for that. So this is, if you can see this is, from NRMP, charting outcomes for match. This is very, very official data, right? This is the data that is published to say what program directors like Dr. Akhondi look for when they are reviewing your application. So, what is that it matters to them when they are saying, okay, should I, interview this applicant, what all this means, right? So obviously both Dr. Akhondi, Dr. Weissman spoke about the scores. Now, of course, step 1 score is pass-fail, but there are still IMGs with step 1 score, right? So there are averages. Now, this is only internal medicine. This is average across all programs for internal medicine, matched IMGs, US IMGs, non-US IMGs, right? So obviously, step 2 CK score averages, non-US IMGs tend to, their averages are higher, competition tends to be more. So you can see that CK score is absolutely important, as Dr. Akhondi had mentioned, right? But then important thing is the research experiences. Now, experiences just means maybe you did 1 research project, maybe 2 research projects. So those kind of things. It includes home country also. But then if you look at this mean number of abstracts, presentations, and publications, so this is where it turns the game around, right? So this is internal medicine, and as both Dr. Akhondi and Weissman have said, look at the publications. A lot of you have asked, how many publications? Now the NRMP says 7, right? For a non-US IMG and 3.6 or 4 for a US IMG. So you can see the competition you are up against, 4 to 7 publications in internal medicine. So why is research important for MAT? This is the reason, because even in NRMP now you can see the importance of research. Then comes work experiences, right? So now NRMP does not distinguish between home country work experience versus USCE, but as we have heard from the speakers, USCE is still very, very important. So when it says 3.8 months or 3.8 work experiences, you can pretty much be sure that it is minimum 3 months of USCE, right? So USCE is important. Volunteering experience is also important, and probably we'll get into volunteering in the next week's webinar. So Swati, post the link for the next week's webinar also, then we'll go into these details. So that's one. Then comes the factors. It's the same thing, factors in selecting for interview, but slightly more I wanted to give you a sense, right? Whether it's step 1 pass, CK pass, attempts are a big deal. So you can see program directors, 80% or more than 80% program directors see any failed attempt in USMLE as a big red flag, 82, 83%, and they're ranking it at 4+. So it's very important for them. Very important for you not to have an attempt. Attempt, as Dr. Weissman said, is a big issue, right? Letters of recommendation. Again, we've spoken about it today a lot of times. 80% of the program directors feel letters of recommendations are very, very important, right? And they are giving it a score of 4. So letters of recommendation pretty much for IMGs means waived letter from US faculty. I don't think you should look for home country letters at all. It is the waive letters coming from your US clinical experience, coming from research. So obviously letters from program directors like Dr. Akhondi, Dr. Weissman will carry a lot more weight. Personal statement, as Dr. Akhondi mentioned about it, cannot be generic, has to have your story, and it should tell us things about you, and don't try to become a Superman or a Superwoman, like he mentioned. So personal statement is going to be very important for those of you who need help. Of course, as part of our gold plan and platinum and bronze, we do help extensively in personal statement and CV. Something we'll talk about next week is going to be program signaling. Signaling is a new concept, maybe 3-year-old after COVID. How do you pick programs for signaling will be very important. Something we'll talk about next week. Geographic preferences, same idea, right? So if you are, for example, interested in matching in New York, New Jersey, that kind of an area, obviously program directors would want you to have worked there, rotated there. Likewise, if your preference could be California, Nevada, Arizona, where I live, program directors will see the preference, right? So it is important. How do you pick the preferences? Some of the things we talk about in our classes, program signaling, geographical preferences, is all part of how we help you in our classes, in our end-to-end advisory. Commitment to specialty, absolutely important. As I was looking at the questions you were posting on multiple specialties, should I apply to multiple specialties? How can I make my application strong? So obviously all program directors look for commitment to specialty, your passion, which is reflected probably by your work experience, by your USCE, by your research. All that is important, but there are people who will apply to multiple specialties, and that's where some of the things we can help. We can help you balance your ERAS CV, because we work a lot. We understand the perspective of program directors. So what they look for, we can probably help. Research involvement, we already spoke about it, right? Very important. It obviously depends on the specialty, but no specialty says research is not important. If you are going into dermatology, surgery, pathology, research will be more important, more publications, but it does not mean FM, IM don't like research. So again, just going from data, this is Program Director Survey 2024, so very recent, and you can see how these things become important. Okay. Who can help with the personal statement? So Shilu, we will have a complete plan out in June. That's when the ERAS token opens. So we will have our faculty, our journalists help out. There will be classes on personal statement. Step by step, we will help. Applying for visa first or USCE. So the question is, should I apply for visa first or USCE? Now, it depends on the country, but from what I understand, even to apply for visa, you need an invite letter. So if that is the process in your country, we do help step by step. So, so Swati, maybe you can post that link, www.usmlesarthi.com/getting started. So that link on our website will tell you step by step, how do you select the rotation, how do you get the visa letter, and how do you, kind of organize all of that. So we do help you step by step, including getting a visa letter and setting up your USCE. What are the requirements for anesthesia specialty? Now, anesthesia is a very, very competitive specialty, as you can understand. A lot of our students who match in anesthesia tend to have home country residency. That's not a requirement, but that helps. So if you have a anesthesia home country residency, absolutely fantastic. Of course, goes without saying, high scores, right? At least a 250 in CK. Relevant USCE. So 2-3 months of relevant USCE will absolutely help you, and research. So I think you can imagine relevance in everything, whether it's USCE or research, really helps. Clinical rotations with Ivy League faculty, is it worth it? It's absolutely, it depends. Why not, right? So depends on what you want to gain out of it. If you are a graduate, obviously maybe do 1 month with, say, Cleveland Clinic or Observership at Mayo Clinic, Harvard, some of those top institutes. But again, if you are an old YOG, you really, really need a very good hands-on experiences. So you can look up our website and see what we have. If you don't have home country residency, how does this competitive specialty work? So I didn't say that it's a requirement. All I'm saying is, if you have a home country residency, it becomes easier to match in specialties like anesthesia, prelim positions for general surgery, and all of that. Same idea, OB-GYN, we've had two matches, I think, this past season in OB-GYN. OB-GYN, again, prefers home country residency, but our students who matched this past season in OB-GYN, they were working, right? They were working very high scores, did tele-rotations with us in OB-GYN, and they ended up matching. So relevant research and rotations can absolutely help, but high scores are needed. Students matching in neurosurgery, we haven't had a student match in neurosurgery in the last 3 years. It's a 7-year residency, very, very competitive. Most of our students who do neurosurgery from the home country, we've had many, they switch to neurology. But I will tell you what it takes to match in neurosurgery. You absolutely need 1-2 years of research in the US, say at a place like Harvard. So full-time research in US is absolutely important for that. University versus clinic setting for USCE, hospital versus university versus clinic setting. So here's how this works. If you are a student still in med school, try to get an inpatient experience, because inpatient experience as a student will be an elective. You will be treated at par with a American graduate, EMR access, patient access, interaction, all that works. If you are a graduate, still get 1 or 2 months of inpatient, although you will be an observer. You will be an observer, but it's good to have that experience. But as a graduate, then you absolutely need hands-on. Hands-on can only mostly be in a clinic setting. So it depends on where you are. We have a lot of rotations like that. Swati can post a link. Inpatient, outpatient, hybrid settings. It depends on your profile. Can transitional year PD provide LORs for both FM and IM? And the answer is yes. Dr. Atut, Dr. Weissman, they provide LORs which work for both FM, IM, and transitional year, right? So it is primary care. Transitional year is PG1 focused on primary care, so it doesn't matter. Can you explain Ivy League faculty? I don't know what this question means. USC in clinical setting with Brown University faculty worth it? I don't know. I mean, it depends on what the description of it is, right? So, the more you describe the question, the better it is, right? Okay, while we are waiting, I think we have one more speaker, Dr. Basu. So, Aarti, if you can call Dr. Basu and maybe bring him on early. Meanwhile, I will answer the question. So we do have Dr. Indrail Basu, who's going to be joining us shortly, and he's also going to be talking about research. Very prolific researcher. He helps our students in research. So Aarti he was scheduled to come in at 12:30 Eastern. So, but I want to get him on early. Can we apply to pediatrics with IM rotation? So I think you got to understand that each specialty looks for specialty-specific experiences, specialty-specific commitment and passion. One rotation in IM is okay, but if you are applying to pediatrics with, say, 3, 4, 5 rotations, how will a pediatrics PD select you, and why will they select you? They will think that for you, pediatrics is a backup, isn't it? So my recommendation is, if you are applying to pediatrics or any specialty, get specialty specific experience. We can certainly help with such rotations and all of that, right? So do that. Can I do fellowship on J1 after I am on H1B? So all these questions are very, very specific. We will take it up in different webinars. There's a lot more to do with this. Just one-liner answer doesn't help. If you are not getting into residency first, all these questions are very moot questions. So the answer is it's very difficult, by the way. Can a step 3 score help with a suboptimal CK score? It can always help, right? So, but I need to see your profile first, and that's where Swati, can help you set up time with us to discuss your profile and how we can help. All right. So I do have Dr. Basu-Ray, who has just joined. So welcome,
Hello.
Dr. Basu-Ray. He's a very prolific researcher. Obviously, he's made his mark, in the US. You've seen him in a previous webinars with us, former program director, now helping a lot of Sarthi students in research. So Dr. Basu-Ray, welcome. And, we wanted to talk about importance of research in math. So why don't you take the stage and get our students some insights into importance of research.
Thank you very much, Mr. Pawan Khera. I appreciate you having me. Welcome, guys. And so, as you guys know, in the entire till 21, 22, 20, we had between 11 to 17,000 people applying for USMLEs. for NRMP match. In 22-23, there was 23,000 people applying. Last year, 50,000 applied. If you go to NRMP site, you'll see the numbers, 49,800 plus people applied. So the competition has increased astronomically. So when the competition increases, then it becomes difficult to get in until you have something which others don't have. Now, what can you have which others don't have? One is you can have a good clinical observership, which Mr. Khera must have explained to you. But that itself is not enough. What do you have academically that will separate you from others? Why? Because even a small program, which is say 4 seats, I know a small program just outside Philadelphia had 4 seats, but there were 2,800 applications. Is it possible to choose 4 people out of 2,800? No, it's impossible. You can't even do it. So how do you expect the program directors to do? So they have developed a strategy, and the strategy is very simple. Now, they cannot take somebody or not take somebody based on USMLE 1. Why is that? Because USMLE 1 has no marks. So you are pass, I am pass, somebody who's passed, they're all same. USMLE 2 has marks. So a couple of years, especially in the last 4 or 5 years, USMLE 2 was an important marker. If you have 250, then even in 2021, you got called if you just had 250. Unfortunately, for the last couple of years, there are thousands of people who have got more than 250. And if you don't believe me, ask people around. They'll tell you, almost everybody seems to get 250. Has the exam become easy or the marking system has changed? I don't know, but that's the basic fact. So USMLE 2 with more than 250 score, unfortunately, has stopped helping last couple of years. Now then, what do I see? Only thing that I see is, do you have a research? What sort of research? I have a lot of case reports I published. Nobody cares. Case reports has no value. What makes a value? A paper in one of the topmost publication, which is like a network meta-analysis. Why? Because if you just go to Google today and type hierarchy of research, you will see network meta-analysis is the highest in the hierarchy. You have one paper on network meta-analysis in Frontiers or American College of Cardiology or any of the top journals that we help USMLE Sarthi people to publish, you will be called, period. No question asked, because you are no more a cat, you become the leopard with the stripe. Once you have stripe, they are going to call you, because that's what America is looking for. America is looking not for any damn cat, but a cat who has got the stripe, because the numbers is in their favor, not your favor. Because if 50,000 people are applying, it's not in your favor, it's in their favor. They can choose whom to take and whom not to take. So it is very important that you have a publication. So what we do for USMLE Sarthi student is, we take you guys, we give you a 3 months course, which is just 1 hour a week through a video. So the entire week you get a 1 hour video, you take your time. As long as you have internet, you can sit on Mars, on the moon, on any planet, in your office, in your clinic, while rounding with patients, and watch that video throughout the whole week. In the weekend, we have a faculty who actually teaches you. If you have any question, answers those. At the end of 3 months, we prepare your research and we help you publish it. We publish not only in top journals, every of our publication is in journals which have impact factor, have high impact factor, so that we can get you the stars that you need on your shoulders that gets you to where you need to go. Now, there are multiple journals. There are a lot of journals which are called predatory journals. How do you know that? Go to Wikipedia, type in predatory journals. If you publish in these journals, they don't take you far, because these journals, anybody can publish if you pay. Whereas we publish in all the top journals. We don't want a person coming from USMLE having a publication that rather than helping him is going to get him on the wrong side. So we help you guys publish in the best of places in top level journals. And we have seen success. We have USMLE people who got into 10, 12, 14 university interviews. Even an American does not get that. So the pathway is very simple. You get to us, we train you, but training, so the whole time you spend is just around 2.5 hours a week. That's it. And at the end, you get one paper in one of the top journals plus, and that's only for USMLE, because we want that sort of kid who comes to USMLE. They are dedicated kids, and we want them to get into medicine. We also offer them one more abstract, which will make sure that your chance of getting in is way higher. Now, next batch is in September. Next batch means the next match is going to be application in September. So if you join now, in the next 3 to 4 months, you will not only have a paper, but you will also have a LOR from me, which says that what you did. Why is that important? So my LOR is little different from the LORs that you're getting from USMLE Sarthi, other mentors, because you're not doing clinical rounds with me, you're doing research with me. So most of the program directors reads that LOR. How do I know? In the past few years, people who have worked with us, they were actually asked in the interviews, oh, you have worked with Dr. Basu-Ray, what was your research? How did you land up choosing this topic? What did you do in your research? Do you know what this question means? This question means you are in. When they have to take 4 people out of 2,800, they have no time to chat with you. They'll just ask you 2 questions, and the first thing they'll try to do is kick you out. But when your CV shows a good paper, those are the guys they want to sit and chat with, because those are the guys they need. So I will stop there, and I can answer any other questions.
I'm getting the question. So first, someone is asking if I join now. So let me just summarize. So if our students join the research course now, they'll get obviously a full manuscript plus an abstract plus an LOR, customized, personalized LOR from you. So all this will be done before September 24th, when the match season starts. Is that correct?
That's 200% correct. Okay. Absolutely correct.
Okay. And so then obviously students, now walk us through day in the life. So what happens when a student signs up for research? So talk a bit about your classes, how they are structured, and how then you divide the work among the students.
Perfect. So what we do is very simple. On Monday, you get a video, you get a link that has the video. Suppose the video is, as I told you, we have the hierarchy. The highest in the hierarchy of research is network meta-analysis, then comes meta-analysis with systemic review, then comes a randomized clinical trial. So suppose we are doing a class on, say, systemic review. So on Monday, you get a video of 1 hour duration, which talks about how you do a systemic review. Same weekend, on Saturday or Sunday, we do it on a weekend, so that because most of you are physicians, some of you are doing internships, some of you are in 3rd year, some of you are in 4th year. So you're not guys who are sleeping at home. You guys are busy guys. So we keep it on the weekend so that you can take your time off and spend that 1 hour one-to-one, synchronous with the faculty to answer your questions like, oh, you said this in your video. What does this mean? So you said we have to search like that. How do you exactly search? So these faculty will physically take you online and show you so that you have a hands-on experience of research and you can start publishing on your own. Then this continues for just 12 weeks. After the 12 weeks, I take a special class where I teach you how you need to use the power you got because of your publication to drive the interview towards your research. Because remember what I told you first. If they ask you a single question about your research, your chance of getting in is 100 times higher because they don't have time to chat with you. Let's be very frank about it. Maybe in 2001, 2002, they had, because there were 11,000 applications, 12,000 applications. With 50,000 applications, they have no time to chat. And these are doctors, remember, they are clinicians, they have clinics, they have inpatient rounds, plus their program director is not, you don't get paid $100,000 to be a program director. It's an extra work. It's a lot of respect, but not a lot of money. So they don't have time to waste with you unless they think you're a material. They need to spend time with you. So I do a round with you, show you, tell you what to do, and then you know how to go to the interviews. And I've heard these things, and I can guarantee you will also come back and tell me the same thing. Couple of people told me, sir, did you talk with the program director the night before? I said, no. Why are you asking me this question? He said, because he asked me exactly the same sequence that you asked. That's because for 25 years, this is what I've been doing. They can't ask you, are you married? They can't ask you, how many children do you have? They can't ask you, are you planning to get pregnant they can't ask you. This is America. This is not any other country. There are fixed number of questions they can ask, and they has to go in a particular way. So we ground you on everything. So 2 hours, 1 to 1.5 hours on a weekend, 1 hour of your own throughout the week is all that you need. We tell you the topic, we explain you the topic in that 12 weeks that we meet with you, and we get you the preparation. And the reason we want you to get in as early as possible is, remember, there is difference between giving USMLE and getting a research paper. USMLE happens a couple of times a year. You can sit anytime, read for 2-3 months, give your exam. That's not true for research, especially the level of papers that we publish, which will get you into interviews, is at a higher level. They take 4 to 6 months. So even if you're planning to go for 27, it's good time to join now, or 28, good time to join now, because you'll have a couple of publications before you actually apply for your USMLE match.
So, Dr. Basu, one more question is, of course, for those of you interested who are asking in the chat, Swati is posting the link. So if you are interested in Dr. Basu-Ray's research course, click on that link, and there is a discount also that Swati can help you with. So, Dr. Basu, the question is, 2 questions actually. One, the myth that community programs don't need research, but second, tell us about the type of journals that you are targeting, that your students get research in, published.
So, I don't want to name some of the journals, but there was a lady who came and told me of a journal whose name starts with C. I don't want to name it, but I mean, it's very easy. Do not get fooled. The world is open. This is a time of AI. You can get every answer. Go to Wikipedia and look at the journals. What are predatory journals? If you have a particular journal, the name C, put it in AI and see what the AI tells about that particular journal. We publish in journals which is there in USMLE site. Go through each of those journals, find out what their rankings are. You'll see some of them are second, some of them are third. They are the topmost journals in the world.
Yeah. So if you click on the link that Swati just posted, you will see the name of the journals where Dr. Basu-Ray's team has been able to publish. So do that, please. And so, Dr. Basu-Ray, the first question, the myth that community programs don't need research.
Yeah, that's absolutely, completely debunked. Completely, I don't know from where that myth even comes. So listen, okay. So let's for a minute imagine one of you is the program director of this thing. Where when I was a fellow, she was internal medicine resident. She's now a program director. This is what she told me. She had 2,800 person applying for it's a small hospital, outskirts. I mean, almost 200 miles from Philadelphia. So how is she going to choose? So this is how she started choosing. First, she said, okay, let's put 250 and see how many people got it. She found when she put 250, she still had 800 people to interview. So she said, Dr. Basu-Ray, how can I interview 800 people for just 4 seats? Then she put in research. She still got 80 people with research. And then she said, okay, let me put in the top level research who I've got. She got 42 people with top level research and she interviewed them. So it's a complete myth that you don't need research. Yes, you did not need research had you applied in 2021 because there were tons of seats, few applications. Today, You're going nowhere. There are hundreds and thousands who applied, who I know, Mr. Khera knows, who have not done appropriate clinical rotations, who have not done appropriate research. They were not even called. Some of them spent $10,000 to $15,000 applying to 80 programs. I know a couple of kids who applied to 80 programs, spending over $10,000 to $15,000. Not even a single interview was called because they can't call. How can they? They can't call you based on your face. They can't call you based on which country you're coming from. The only objective thing is, have you researched so that you are going to be a physician scientist and I want to take you for my own program?
Yeah. Couple of questions, Dr. Basu-Ray. First is, one student says, I'm applying for psychiatry. Is your research course going to help me in psychiatry? Do you have psychiatry specific,
Okay.
research?
Yeah, I know. I get this question all the time. Very interesting question. So let me make this very clear. I've spent 25, 30 years in medicine in this country. At the residency level, they are not looking for specialized programs. I'll tell you why. So they are taking you as a psychiatry resident or a gynae obs resident or an internal medicine. So you're the lowest of the rung. They are taking you as a student. They are not taking you as a psychiatrist. Leave alone, they are not taking you as a professor of psychiatry. So they are not expecting you to have 300 research on psychiatry at all. Let me give you, my next sentence is going to sound even worse. You might have a research in gynae and obs and you want to apply for internal medicine. Can you? Yes, 200%. Because they are taking you as a student. They are not expecting you to be in fact, I shouldn't be actually saying this, but my experience, I'm telling you this clearly. If they find you have too much on that particular set, they're not going to take you. Because they are looking for somebody who's going to work with them for 3 years, 4 years, and has research knowledge. So whether you do it in psychiatry and you're applying for pathology, whether you do it in gynae obs and you're applying for medicine, they don't care. Because for last 2000 years, the research methods are same. Topic can be different, but the research methods are same. All they are looking for is somebody who's just a student, but has learned research in their medical school, which if you have not, that's why you are coming to USMLE Sarthi, you're learning from us. That's all they need. This is a young kid who knows nothing about psychiatry, but does know how to do research. I'm going to take him. Why? Because there's a big probability that this guy in the future will publish in psychiatry and I will get the credit for that. So your research in psychiatry because you're applying to psychiatry or pathology because you're applying to pathology doesn't work. And if you have 10 research in pathology, 9 out of 10 they are not going to take because they're not looking for professors of psychiatry or professors of pathology. They're looking for just a nice student who knows medical research, who knows biostatistics, period.
Okay. Thank you. And I know you are based out of Tennessee. So in terms of the research course and in terms of the logistics, students based outside US or in different time zones, how do we do the coordination?
So we do the coordination is very easy. Just like, so what we do, the coordination is most of the students that we have as in USMLE have their student from all over the world. So somebody is in Japan, somebody is in Europe, somebody is in India. So we tend to fix a time which is good for everybody. In case we do not get such a good time, we can always fix more than one time, which we have done. So that one is an American time which covers even Australia, whereas another is a time which covers India, China, America, Europe, because that's only 1 to 2 hours, 5 hours from Europe, 1 to 2 hours plus minus from India. So we cover the entire Middle East, Europe. So we have multiple time zones we can set up. We set up this teaching so that it is on a weekend and comfortable to you guys so that you guys can join. And it's all on the, now suppose one weekend you're on call, you could not do it, or you have a family occasion, that's fine. We send you within 24 hours, you get the recorded lecture. So you can go through it. And remember, once you sign up for our course through USMLE, you can do that course 100 times. We never stop you. So suppose you miss a course, you can next batch you can join the same course and learn from them. So
Yeah.
we never stop anybody.
Last question, some students may need more help than the others, right? Because some may be starting from scratch in research, others, may already have a grounding in research. So how does your course handle these students who may need some one-on-one help?
So how they do that is very clear. So what we do is we have WhatsApp. Every batch has got a WhatsApp. So suppose my name is Indrail, I am starting new. First of all, we take for granted most of the people are brand new. Because even those who come with research, they come with research publishing in some predatory journals from India, Libya, Egypt, which are of no value to us. Those journals will not get you into USMLE. You need to publish in top European or US journals. So for us, 99.9% are brand new. So that's number one. So we take everybody as new. Now, if somebody has a problem, he just WhatsApp. In that WhatsApp, our operation manager is there. Our 2-3 different faculties are there. He just operates. Okay, Dr. Basu-Ray, you taught me this weekend. I couldn't understand that part. Can you explain to me? Generally, what happens is, as I told you, remember that our weekend class is 1 to 1.5 hours. I told you guys that. That's a little bit of a lie. Why is it a lie? Because there is a student in every batch who comes and tells us, I didn't understand this. So what we do is, after that, the faculty sits with those students, and it can take 1 more hour or 2 hours till he or she understands, because our job is not to just teach you and forget. I don't care whether you understood or not. Our job is to make you a physician scientist. Why is that? The reason is very simple. Today, you join a residency from USMLE Sarthi. In the first month, you are asked to present in the journal club. You do a bad job. What do you think your reputation will be in that entire residency? So we want to teach you. We want you to be real physician scientists that an American medical school teaches most of their students.
Yeah. What is a typical group size for each of your research projects?
Not more than 15 people in each batch.
Okay. So I'm getting other questions which I'll answer. How to contact Dr. Basu-Ray. So you have to contact Swati from our team, and she'll give you the information. How to join the WhatsApp information group? Well, so you first enroll in the course, then Dr. Basu-Ray's team will put you in the WhatsApp group. They are offering a discount, so Swati can give you all that information as well. So click on the link that Swati has just posted. I think there is a $500 discount, so you can enroll in that course. So Dr. Basu-Ray, last question: is one project publication shared by 15 people? I mean, what I think the question is, they're trying to understand how many co-authors will be there in the paper that they are involved in.
Yeah. So what we try to do is the field of publishing depends on our job. Remember, is to get the world's best publication for you. So that is a little bit dicey. Why? We can do it because we have done for 25 years. Because top level journals are very selective with how they take. Now we can do that because most of the top level journals, I'm a reviewer for them. They come to me asking for articles. How many people each journal takes depends on journal. For example, there are some journals which say they don't take more than 12 people. So you are not going to have more than 12 people in that particular article. Some journals we can take 15 people. So we can take 15 people in one article. But remember, the question is that number is not important. What is more important is we will get you publication, one as an abstract, one as a full paper, in one topic or the other. And we do multiple topics. We just don't have one batch, we have multiple batches. So every week, every month, we have multiple topics that we work on. So you will get yourself. Some people say, for example, BMC, which is Springer Nature Journal, impact factor 6, it says they'll not take more than 10 people. So unfortunately, we cannot put more than 10 people there.
Yeah. Okay. Well, thank you, Dr. Basu-Ray. This was much appreciated. I think your insights are invaluable when it comes to research and the residency match. So Appreciate your time, and thank you very much for
Thank
giving
you.
us your part of your Sunday on a long weekend. So thank you.
Thank you very much. Appreciate that. Take care,
Thank you.
guys.
Thank you.
Bye.
All right, as we come to the end of this webinar, again, if you have questions, the Swati has posted links for Dr. Basu-Ray's research course. So take a look at that. Let us know. Also important, next week we have a webinar. So Swati posts that link again, for next week's webinar where we dive deep into the upcoming match seasons, right? It'll be very important for those of you applying this season in terms of timeline, in terms of what you need to do in the next 4 months. So that I think is a very, very important aspect that many of our students will need. So again, free webinar next week. Take a look at that. If you are interested, and like we mentioned as part of all of this, if you have visa issues, Tele-rotations is the way to go. Research is always remote, so it'll help you. You heard from Dr. Akhondi in terms of what his program looks for when it comes to residency applicants. You heard from Dr. Weissman and Dr. Basu-Ray as well. So keep those things in mind. If you are looking for rotations, on-site rotations with Dr. Weissman, with Dr. Akhondi, it's a part of networking, part learning. They both help. If you're looking for tele-rotations, take a look at those. If you're looking for research, take a look at those. We focus only on IMGs and how to get them matched. So hopefully this was useful today to all of you, and I'll keep the window open. Whatever questions you have on our plan, on how to set up meetings with us. Many of you have asked questions, this is my score, can I match? I think we'll need some more information in terms of what you've done, in terms of what your plan is for the next 4 months before we can give that detailed insight. And it's better to set up time with Swati or I or others on my team. I'll take a couple of questions that I see. Could you tell us the range of step 2 CK score if it's a low score? So I think 220, 225 is always on the lower side, regardless of the specialty, right? So 230, 230 plus, you become competitive depending on the specialty. So again, I'm going to keep this open. You can grab the links for all the rotations, research, our match plan, how we can help you, how research is important. All of that is available if you are interested. And otherwise, I'll see you next week if those of you interested and want to know how to plan out for the next 4 months. One important question that I see is journal submission fee included in the research program fee? Yes, both Dr. Weissman and Dr. Basu-Ray, all fees are included, so you don't have to worry about anything. Do you assist with programs that entail research programs in Harvard? We don't directly work with Harvard, so I don't know what the question is. So if you are interested in having a position at Harvard, so we do have classes that can help you get a research position, how to go about it, how to network, how to talk to the faculty, what to talk to the faculty about, all that we can help, right? So a lot of our students end up researching at Mayo Clinic, Cleveland Clinic, and all of that. So all that is part of our match plan. Will we get details of the research in the link? The link is already posted up if you go up the chat, Devi. But Swati, can you post the link again for Dr. Weissman's research and Dr. Basu-Ray's research? Okay, so this is Dr. Basu-Ray's research just posted, $500 off. I think 2,000 is the fee for 2 publications till September and a strong LOR, and you can get associated with them till another 2 years. But the publication fee is included for 2 journals. Okay. Likewise, you will see Dr. Akhondi's research and Dr. Weissman's research also. All right, so hopefully it was all useful, and I will see you next week where we'll talk about the upcoming match season and the timeline.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.